Canada. My dear friends, this is Pranav here. We are indeed honored and truly blessed to have Dr. Navneet Shah from India. Dr. Shah has several laurels to his name. He is an eminent endocrinologist operative in the segment of diabetes, and he is going to share his views on diabetes today. Uh, we we will take the questions. Couple of housekeeping points. Whatever you write on the Facebook wall of Dr. Jayesh Jashet, Dr. Navneet Shah, and Manas Ranjan Raut will be televised globally. If you have a question on YouTube, feel free to drop the questions on YouTube, on different social media, Periscope, and Twitch TV, Twitter TV do not allow to take the questions on, uh, and we will not be able to attend those questions. Dr. Shah has an illustrative career as a diabetologist from India. He has served many patients all across the world. He is a very familiar household name in India, and we made the selection of the faculty based on the popularity. He appears for several shows all over the world, and today we are fortunate to have Dr. Navneet Shah with us, and uh, here goes Dr. Navneet Shah from India. So thank you so much, Dr. Shah. This is Pranav here, and we are live all across the world, and healthcare professionals, interested people, those who want to know about diabetes, are joining us from different channels. So nice of you for allocating time today to reach to the masses, Dr. Shah. Thank you so much. And before we start proceedings of today in a format of question and answer, I would like audience to just hold the nose, stay patient. We are here for next hour, an hour and a half to take the questions from you, and we are very thankful for your joining in masses. Welcome to you, Dr. Shah. So before I, whenever I attend this kind of podcast, broadcast, transmission, always I feel that when the guy who introduced the faculty completes his introduction and hand over to the faculty in charge. So not wasting any further time, may I please request you to kindly embolden the audience, educate the audience through your illustrative knowledge and subjective understanding about what diabetes is all about. Doctor?
Thank you, Pranav. First of all, I am very fortunate to have you as a friend and invited me to intercontinentally, I would say, across the globe to the population. And I am going to speak about the diabetes, but when I went through the detail of NPF Pharma Biotech, I understood that you are not only a technologist, but you are a scientist also. And this 4K Iridium technology is your brainchild by which you are connecting us to many people. So indeed, I must congratulate you, and I must thank you also for giving me this opportunity to meet many people across the globe and to discuss about the diabetes. And I wouldn't say that I would educate them. Many people would be more knowledgeable than me, but I would discuss what my views are on diabetes. So let me begin first as a introduction to the diabetes. What is diabetes? Our human body is kind of a thing where it maintains the glucose level within the circulation at a normal rate. And usually when we look at the blood sugar values, then their fasting values are around 100 milligram per deciliter, and the post meals or post lunch values are around 140 milligram per deciliter. If these values become abnormally high, then it could be either classified as pre-diabetes or diabetes. Likewise, if the value remains between 101 to 126, it is impaired fasting glucose, which is a pre-diabetes. And if the post meals values remain between 141 to 199, it is known as impaired glucose tolerance, which is also a pre-diabetes. But when these values cross fasting above 126 and 2 hours after meals crosses the 200 milligram, then we call it as a diabetes. The another additional dimension to this is HbA1c or glycosylated hemoglobin. Now, glycosylated hemoglobin is an end product of hemoglobin and blood glucose interaction, which glycates the hemoglobin. Hemoglobin is a part of red blood cells, and this level goes up proportionate to the blood glucose values in the body. And so, normally the glycosylated hemoglobin remains below 5.6 or 5.7%, which goes up to 6.5 or more. It is defined as diabetes, and the any values between 5.7 to 6.4 is a pre-diabetes. So, the definition of diabetes is characterized by high blood sugar which are not within the normal range, and that is the definition of diabetes. You may have hypoglycemia, you may have diabetes insipidus, they are all different, but diabetes mellitus is characterized by high blood glucose values in the blood other than the stipulated values in the human body. Now, Pranav, you would think that why this is important, why people are talking about diabetes everywhere. So, we have seen a pandemic of COVID. This is a non infective pandemic, it is a pandemic of uh, kind of chronic disease where it affects multiple people, many population. And if you look at the 2019 IDF, right now 463 million people in the world are suffering from diabetes, and it is estimated that there would be 700 millions in 2045. Out of this, 79% of the diabetes population is low and middle social income group. 1 in 5 above the age of 65 has diabetes, and 1 in 2 is undiagnosed. So there are 232 million people are having diabetes, but they are not diagnosed. Not only that, if you look at only US expenditure, it is a $760 billion per annum, which is the 10% of the health budget expenditure because of diabetes. And there is 1.1 million children and adolescents who are suffering from type 1 diabetes, and then there will be 375 million are increased risk out of the 720 live births in the population. So you can understand that the extent of affection of diabetes to the population, and I am talking about the healthcare expenditure. Then you can also look at the loss of days, that because of the diabetes morbidity, and then there are many issues related to the diabetes. So it is very essential to know about diabetes and to know how to keep the diabetes under control, and not only that, how to keep the diabetes without complications over the lifespan. So over to you, Pranav.
Thank you so much. Whenever we listen to faculty of a very high rank, we feel like not to interrupt them and to go with the flow of conversation. Dear viewers, as we all know that more than 100 million Americans living with the pre-diabetes and diabetes, and it is no surprise that the people with the diagnosis uh, comes from all walks of the life. Diabetes is not a stigma, it's a medical situation that we all succumb to, and we all need to seek the proper guidance in a most scientific manner. And today we are fortunate to have Dr. Navneet Shah from India. When I was thinking about this talk show, hosting this talk show, I was referring some of the articles in which I came across very interesting findings, comments made by Larry King, a very eminent TV host, that when you get to know the heart pain, you feel like the heart disease is ultimate. But if I had to rate number one, I would put Larry. This is what Larry King, a very eminent radio host, talk show host in U.S., quoted that I would put first the heart disease and then the diabetes. And all doctor now is now say that I can transpose and they can put even diabetes first. So diabetes is quite an important healthcare condition that we all need to be aware of. So, Dr. Navneet, coming to Dr. Shah, coming to the next question, if in case patient is diagnosed with the diabetes, what are the remedial measures, and what would you recommend to them, and what will be the course of medication? And I know I asked you several questions, but you can segment them one by one, and can you share more about the mode of diagnosis of diabetes, please?
Thank you, Pranav. So before I answer your questions, I would just like to mention about the types of diabetes. There are important division which we should know. The one is type 1 diabetes, which is because of the insulin deficiency. And the second most important, which prevalent nowadays, which is seen in 80% of the population of diabetic patient, is type 2 diabetes. Out of this, they take chunk of the number of patients, but we have MODY, which is a maturity onset diabetes of young, which is a monogenetic diabetes. Then we may have a diabetes in the neonates, which is almost 100% before the age of 6 months is genetic. And then we have pregnancy related diabetes, and we have uh, diabetes because of the diseases of pancreas. So here my focus would be essentially about the type 2 diabetes, which happens in the middle and the elderly people, and this diabetes is prevalent in the highest number across the globe. And our concern is, of course, all diabetes are important, type 1 is also equally important, but now the epidemic of type 2 diabetes, which we are focusing on. So that is one thing which I just would like to say. If any questions are coming up for the types of diabetes, we'll discuss later on. But the one is type 1, which is insulin deficiency. The second one is type 2 diabetes, which is a combination of insulin resistance and beta cell failure over the times, may have some genetic predisposition, and then we have monogenetic diabetes. Now, your question is that why this diabetes treatment is important. As you already mentioned, that Larry King said that diabetes is also equally important, and he ranked it second. But now you have read so many things, and you think that diabetes is also very important health issue. What I am telling you, that diabetes, if it is not under control, then it has its consequences. Likewise, type 2 diabetes, when the patients come to you for the first time, around 20 to 30% of the patients have already complications related to diabetes. And not only that, there are some complications which can be seen even in pre-diabetes phase. So this is very important. And the most important thing, that these sets of complications are different. Like you have a microvascular complications which affects the small blood vessels, which can affect the nerves, it can affect the retina, it can affect the kidneys. They are known as microvascular complication. But when it affects the larger blood vessels affecting the brain, heart, and the peripheral limbs, they are known as macrovascular complications. And then there are some miscellaneous complications also, like cataract or the proneness to infection, poor wound healing, infertility, impotency. There are many things related to that. So diabetes alone is a book, not a chapter in the field of medicine, which can affect so many things. And it is one of the important cause of blindness. It is one of the important cause of chronic kidney disease and dialysis, and it predisposes you to heart attack and severe stroke in 4 times, 2 to 4 times than the normal population. So once you have a diabetes, you are vulnerable to this kind of complications. If I am talking about my country or Asians, then we are thin fat Indians. We are more vulnerable to have diabetes complications. We developed diabetes 10 years earlier. We have severe diabetes, and that is why it is very imperative to have knowledge and good control of diabetes to have the benefits of the management. Over to you, Pranav.
Thank you. Quite interesting. Dear viewers, this is Pranav here, and we are hosting Dr. Navneet Shah to have this conversation on the subject of diabetes. Dear viewers, the popularity of the doctors can be rated based on the feedback that we received when we started this communication. In less than 10 minutes of the time, more than 15 shares and 22 comments can be viewed only on in the timeline of Dr. Navneet shared. We will not be able to accommodate every individual's aspirations, emotions, question, and answer. That can also be taken care of after the proceedings get over. But thank you so much for joining us. We understand that you all can hear us, hear this conversation well. As I would like to, and this program is being brought to you by NPF from Canada. We are live on Mixture TV, Talk TV, Twitch TV. So if you are not with the Facebook account, you can join us via Twitch TV as well. It's an open source. You do not need any any account in order to listen to this conversation. The viewers of NPF can go to the Facebook of NPF in case if they have a question. We will not be able to pick up the questions from the blind spot. I thank you very much again for joining us. And as Nick Jones, an eminent dancer and a choreographer, said once that diabetes sounds like you are going to die when you hear for the first time, but it is always the educative approach of the doctor and not to make you feel uncomfortable and frightened and to enhance the confidence level through the route of educating. uh, I, I came up to the level where I can feel myself confident to confront the situation I landed into. That is what Nick Jones says. And getting inspiration from all these eminent scholars, we designed the program. So, what are the once you are diagnosed with diabetes? What are the remedial measures, doctor? What would you recommend? What a person should do, like, or what will be his way of approaching to the diabetes beside to the medication, doctor?
So, first thing, Pranav, when anybody is diagnosed, which is type 2 diabetes, then everyone would advise those people to have a healthy lifestyle. What does it mean by healthy lifestyle? So, healthy lifestyle can be divided into essentially two important aspects. One is diet, and the other one is exercise. Now, diet is a very important aspect for the management of diabetes in India because we are very high carbohydrate eater people, and our diet consists of more than 60% of the carbohydrates in comparison to Caucasians and the other Western populations where they have a lot of protein and fat. So carbohydrate restriction is one important thing with the aim of reducing the high glycemic index carbohydrate. So carbohydrate we should use is a low glycemic index carbohydrate, and so we can have a grains unrefined, we can have multiple vegetables, we can have fruits and some nuts. They are all useful for the diet. Then we should increase the protein content of the diet, which should be in form of you can have the non-vegetarian source and the vegetarian source from the pulses, dalias, milk, eggs. All those sources are very important. Then another important thing is fat. Fat is an essential part of the diet, but we must avoid saturated fat. That is very important. So our fat content of the diet should be less than 7% of the saturated fat. Now the saturated fat comes from fatty beef, lamb, pork, poultry with skin, beef fat, that is tallow, lard and cream, and so many things which are, and then butter and cheese, they are all saturated fats. In a one sentence, I can tell you that those fat which are solid at room temperature are the saturated fats. So we should avoid saturated fats, and we should focus on fruits, vegetables, whole grains, low fat dairy products, and poultry, fish, nuts, and liquid vegetables, but not the tropical oils. Then in fats, we can have monosaturated fats, which there is a long list of these things, and then we can have a polyunsaturated fat. So I would say that the food which are like tofu, soybean, chia seeds, flax seeds, coconut oil like medium chain triglycerides, and all those things are useful in the diet as are the fat is concerned. Every gram of fat is a 9 calorie. But when we see that macronutrients of the component of the diet, then we must have low carbohydrate, adequate protein, and low saturated fat in our diet. That is a very basic thing. Then there are very variations of diets. You can have DASH diet, you can have Atkins diet, you can have keto diet, and then there are new concept regarding the intermittent fasting. So I'll briefly mention that keto diet is when your carbohydrate content in the diet is less than 50 grams in day. When you say low carbohydrate diet, it is around 150 grams per day. That is very important. Then intermittent fasting is you take one day normal meal, the other day very low calorie meal, that is intermittent. And then time restricted fasting, which is like you eat in 8 hours of the period, which is you can take your lunch at 12, dinner at 8, and besides these two meals, you don't eat anything. That is a time restricted fasting. So these are the various things. Now new concept of Roy Taylor and reversal of diabetes is based on couple of these things where you can reduce your weight by 15%, where in the initial stage, if you can do weight reduction with exercise, you can have the benefit of a reversal of diabetes in certain population. So these are the various things which we can keep it in mind as far as diet is concerned. So we may need to look at our diet constituents, our calorie, because if you take lot of calories, even if you are not taking carbohydrate, but lot of calories also will make you fat, increase your insulin resistance, and worsen the diabetes. So these are the things which one should keep it in mind when they are planning for diet. Another important thing, don't take two meals in a day or one single heavy meal, but take your diet in four divided meals, like you take 15 to 20% in breakfast, 30 to 35% in lunch, 15 to 20% in afternoon snacks, and 30 to 35% in dinner. By doing this, you don't stimulate pancreas to a very great extent and produce the effect by which pancreas is stimulated, produce more insulin, and then produce hyperinsulinemia. So these are the certain concepts about the diet which one should keep it in mind when diabetes is concerned. Over to you, Pranav.
Thank you so much. It seems that the proceedings are reaching globally. We are receiving a lot of positive feedback, and if I do not acknowledge or, if I do not acknowledge or take some notes from the feedback that I am receiving, it would be like not doing justice to the people, those who are remotely joining with absolute commitment. I would like to acknowledge Jayant Virjilal Prampat. He says that Dr. Shah is having an amazing knowledge about diabetes and he has helped many lives, and I'm one of them. My best wishes to respected Navneet Shah. Pranav, your voice is the subject. Is on Pranav, your voice in the subject and bringing Dr. Shah to explain uh, uh, will help many. And thankful to you both. Thank you. Thank you, dear viewers. Where our program success depends upon your feedback, and we are so thankful, which we cannot put in words today. And thank you so much for joining us. As Dr. Shah referred that insulin, when the insulin word comes, everybody feel frightened. Oh, injections and uh, what insulin is about, and will I be paralytic always in order to have syringe every day? When I was growing at India, the syringes were too big. So, would you like to share something more about this injectables, insulins, and its needs in human body, please?
Pranav, injection is the bottom line in the type 2 diabetes management. We start from lifestyle, diet, exercise, and there are many oral drugs available for management of diabetes. But if the lifestyle plus oral drugs they do not control diabetes well enough, then you need injections. And these injections, now injections, previously only insulin were available as injections. Now we have non-insulin injectables also. They are GLP-1 receptor analogs, and there are pramlitelinide, which are also non-insulin injectables. But what I'm telling you that insulin is important treatment part for the management of diabetes in certain situations in type 2 diabetes. The first, when diabetes is not under control with lifestyle oral drugs, then you need insulin. Insulin is required in pregnancy, which could be still a type 2 diabetes or gestational diabetes. Insulin is required when there are acute illness, like person has suffered from myocardial infarction or person has got pneumonia and hospitalized. So any critically ill patient will need insulin. Patients who have like malaria along with diabetes, or patients who have diabetic ketoacidosis for some reason, then they would need insulin. There are certain patients who are on some drugs, like patient who underwent transplant, renal transplant, and on immunosuppression drug, he would also need insulin. Or those patients who are on steroids, they would need also insulin. So insulin is a very wide subject, and if anybody tells you that you have to take insulin for good control of diabetes, or you have a situation where insulin is needed, your healthcare provider tells you, don't be afraid of that. It is not habit forming. It is not certain that once you start insulin, you will have to take for lifetime. So these are all concepts. When you start insulin, it doesn't tell you that your has become very severe and grave and you are in danger of dying. Don't believe these things. Insulin is the most essential life-saving anabolic hormone which can be of great help in certain situations. Over to you, Pranav.
Thank you so much. It seems that our flow of conversation is going in a direction as I was preparing the script and I heard about uh, uh, any suggestion coming from anyone, Dr. Shah?
No,
No.
nothing.
Okay, okay.
Thank you.
Sorry for
I was just
interruption.
asking my wife to start AC. That's it.
Okay, okay, okay.
It's very hot
And
here, na?
yeah,
It just rained today and then it has become very humid now.
that's right. The
Yeah.
voice is very clear, dear viewers, and he is remotely joining us, and we understand the situation we are into. And as once Tom Hanks quoted after having diagnosed, he is an eminent celebrity in a show of Letterman. He quoted that everybody is going to have some degree of health problems, and as we get older, and we need to learn to live with this kind of health problem. And what Dr. Navneet Shah has stated just now very much goes on the same line. Dear viewers, if you are finding difficulty in following the Facebook, and if you wish to hear the conversation, high resolution conversation, you can obviously go to NPAF YouTube. Real figures will be out after 24 hours, but great number of patients as well as the listeners are joining us globally. We will not be able to accommodate everyone's request, and the question and answer for that, Dr. Shah resides in Ahmedabad. You need to get his get his appointment in order to have your question answered. So, what would you like to share more about the conditions and the kind of diabetes diabetics are facing in present scenario, globally as well as in India, doctor?
Yeah, Pranav. The most important thing is the now there are a lot of awareness about the education and diabetes and its complications, but there are two important things. One is that the expenditure and the amount they have to take themselves away from the work, that would be very important. There are many countries, you are fortunate one where your healthcare is taken care of by government. In our country,
That's true.
our our healthcare is paid by the patient's pocket, especially the outdoor patients. So that expenditure, investigations, monitoring, time to see the doctor, all those things are very important. And out of all, the family, when one person in the family is suffering from diabetes, his dietary needs, his exercise needs are different, and you have to sometimes cannot generalize the need in the whole family because children's need are different and the other people need different. So there is a problem issue related to that. Even then, the lot of education, the most important thing is that to see the doctor and the to be in touch with the healthcare provider. You may not have to go to the doctors, but nurses, educators, and other people are also equally important in the system by which you can solve many of your health related and diabetes related problems. So the first meeting, when I see the patient, I tell them why you need treatment. So that is the most important thing. Why one needs treatment, you have to educate the patient that by treating diabetes, you have the improvement in health. Second thing, what are the goals of treatment? Then you have to tell that we are the now goals will depend upon the lab values, goals will depend upon the continuous glucose monitoring system and time in range values, and the goals, when we talk about the goals in the management of diabetes, it is not the only sugar goals. There are many things related to this. So what are your lipid goals, what are your blood pressure goals, and so many things, what are your exercise goals. These are all important things. So when we talk about the management of diabetes, it is the comprehensive management which includes the blood sugar management, blood pressure management, cardiac management, early detection of coronary artery disease, renal pickup. You have to find out renal involvement early. You have to look at the fundus. You have to take care of the feet, and all those things are important. And at the same time, your treatment should not produce any adverse effect. It should not be costly. It should be making patient comfortable. It should be easily available. It should be uh, safely taken, and then this treatment should not have adverse effects on the heart, on the weight, or should not have very kind of severe hypoglycemia which can endanger the patient's life. So the once you diagnose, the first thing which you tell them that your why it is important, treatment is important, what are the goals, what is the hypoglycemia. So these are the all education part of the diabetes which everybody, every diabetic patient should know, and they should know how frequently they should contact the healthcare providers, because here the doctor is like a guide. He doesn't do anything. He won't give you injections or he won't do dressing and all that. He will guide you that what you need to do in this situation. So I think, Pranav, these are the in comprehensively I would say that once those patients who have been diagnosed as diabetes, they need control, monitoring, and follow up.
Exactly. And doctor, very important question comes to my mind is that once you are diagnosed with diabetes, everybody says that curtail the blood sugar, curtail the blood sugar, curb the reduce this, reduce that. So how scientific is it to stop the complete intake of blood sugar in such a situation? Would you be able to share something on that?
Pranav, everything which you eat is a calorie, and that ultimately is converted into sugar. If you want to have 200 calories in a day, you have to take the food which satisfy your stomach. It gives you the satiety, and it gives you enough of the all kind of macronutrients and fiber and flavonoid. So even American Diabetic Association recommends 2 teaspoonful of sugar in a day, but if you are taking 20 cups of tea with sugar, it is not advisable. So it's a moderation of the things. There is nothing which is absolutely contraindicated in diabetes that you can't eat this, you cannot touch this. That is not the whole thing. But in the purview of the rations which you have been allowed to take, it must be understood that these are the things which can be taken. So if somebody comes and tells me that today is my anniversary and if I can take a cup of ice cream, I would say yes, you can take a cup of ice cream, but look at your calorie intake of the ice cream, cut down with the other food, increase your exercise and just compensate it. So I think there are some relaxations in the diet which everybody can follow. So I wouldn't say that one has to be so strict that they cannot touch the sugar and they can live like that. Thank you, Pranav.
Yeah, I have a faculty of mine. I will have to take her feedback as well. She is Dr. Darshana Pandya. She is a professor with a very eminent Ayurvedic university, and she said that the light cause of the diabetes and treat accordingly is very important. She is complimenting you, doctor, from Jamnagar, Dr. Darshana Pandya. Thank you so much for joining us, Darshana, and your message is televised globally. Dear viewers, we are live in US, in Canada, in Europe through Periscope, and these proceedings are being viewed by many number of viewers. Last year, people emerge as the proceedings get over. We are not in a position to accommodate everyone's aspirations and opinion, especially from Dr. Navneet Shah's timeline. Dr. Shah resides in Ahmedabad. You can be in touch with him. Dr. Shah, before I switch over to the next question, I would like to acknowledge each one of you, and I have a small. I myself have a question for you, Dr. Shah. Where do you actually practice, and what is the most appropriate way to establish connectivity with your good self as a diabetic expert?
I am practicing in Ahmedabad. I have my clinic, consulting room, and I am attached to Sterling Hospital. All new patients, we would like to have in-person consultations because unless you see them, you cannot make your decisions. But thereafter, we can have for some time, like a follow-up for 6 months, we can do telemedicine also, or 1 year, depending upon the kind of patients having complications. So, but let me be very clear that these are the now COVID has taught us about the telemedicine, and many people they contact you on telemedicine platforms, but at least the once you have to contact them personally, then it would be very easy to give them follow-up suggestions on telemedicine. So I can be contacted on my email, I can be contacted on my phone number, which I'll give you to everyone, but and then I'll write down the timings and my availability also. So Pranav, in due course of time, whenever we find an opportunity to give these things, I'll just give it to you and then I'll put it on Facebook also.
Okay, no, I urge you because after the proceedings get over, whosoever are anxious to or eager to get your appointment, you deal with them through Facebook Messenger or at a local level. We appreciate your time and we are truly honored to have you. And with this, on the subject of diabetes, there are many things that you need to learn. And what would be the most important issue you would recommend to look after in cases of type 1 diabetes and type 2 diabetes, doctor?
Type 1 diabetes is a very peculiar thing because there are children who could be of a small age. To educate them may not be very easy, and then the parents they are very anxious and they have a very difficult situation. A child, type 1 child in the family needs lot of attention, lot of resources, lot of infrastructure benefits, and then expenditure. So it is not easy. And when you give them, because type 1 diabetes would need insulin, and they would need insulin at least 3 or 4 times in a day, and then the mother would say that no, he is a small child, you can't give him 4 injections, and then they would bargain about all those things. That doesn't help. So when we are treating a child with type 1 diabetes, glucose control is very important. At the same time, the growth of child is very important. So many people, they are just satisfied with the child doing good, but whether the child is appropriately growing or not, that is also very important. We have some relaxation for the control of diabetes in children, where the strict criteria for control in adults, they are little bit relaxed in children. Second thing, the most important, the management of children, the basic thing is that they should not need hospitalization for high blood sugar. They should not need hospitalization for low blood sugar. That would be very important. And at the same time, then they should have a reasonably good control of diabetes. Another important thing which I would tell you, that every child with type 1 diabetes needs annual checkup every 5 years, because many a times what happens, that for managing a children, it is usually a glucocentric management, but these children do have complications affecting the kidneys or affecting the eyes. So one must be very uh, judicious about the evaluation of complication after the age of 5. Third thing, they are very vulnerable to the complications of microvascular complications, because microvascular complications essentially depend upon two things: control of diabetes and the duration of diabetes. And in children, we need to have a long duration of diabetes. So type 1 children would need very huge attention from the healthcare provider, education, resources, all those things are very important. And once they grow up, they start taking insulin by themselves, then things become little easy. But then during the adolescence phase also, transition from the child to the adult needs attention because of the hormonal level, and then because of the attention of the uh, attitudes and mental things also. And so you can have right from basal bolus therapy to insulin pump therapy in children for the better management of diabetes. So Pranav, that is a very vital thing, and I think many people, many parents would be usually educated. But then if you think about the insulin pump, the cost is sometimes prohibitive. The advantage is there, but the advantage, whether it really uh, cost effective or not, we still do not know in our setup. Because I am sure Canada is the pump is given by the government, but here the pump is not given by the government, and you have to purchase by the patient's relatives.
Yeah,
No,
socioeconomic
hold on.
socioeconomic
Constraint.
factors, constraints, and socioeconomic equations are very vital in attending and addressing certain critical medical conditions. Point well taken. There are a couple of questions I would like to take on at this point in time. Devang Kambolgia is asking that any misdiagnosed moody patient treated with insulin in initial life have the chances of type 2 diabetes, doctor? And yeah, yeah.
Yeah, Modi diagnosis is not done routinely, because there are some sectors we are doing. Now, any child up till now, it has been taught that below the age of 15 or 20 would be type 1 diabetes. But now Modi has changed the scenario, and we have seen number of patients who initially were thought to be having uh, type 1 diabetes. They may be moody or rarely type 2 diabetes. So there are certain characteristics, like the a Modi patient will not come with the ketoacidosis usually or rarely. In Modi patients, you don't have the stigmata of type 2 diabetes like acanthosis nigricans or polycystic ovaries. Modi patient will have one parent diabetic, and the generation wise, one generation has parent diabetes. Above that also one person may have diabetes. So Modi has some characteristic, and now Modi gene studies are done. There are 11 types of Modi patients, but that study right now would cost you in Indian rupees would be around 20,000 per patient for genetic evaluation for Modi. While if you evaluate the patient for type 1, then it becomes little easy that you look at the C peptide level and you look at the insulin antibodies, or you look at the GAD antibodies or zinc transporter 8 antibodies, and you can find out. So it is easy. It is little less costly than diagnosing the Modi. So when you are dealing with an age group of diabetes which is around uh, 10 to 25, you have to be careful. This could be type 1, this could be Modi, or this could be type 2 also. If like both the parents are diabetes, then it is very likely that this child might be type 2 diabetes. And when it is coupled with certain stigmata of type 2 diabetes like acanthosis nigricans or polycystic ovaries or NASH or something like that, then it could be type 2 diabetes. So laboratory would help, but many a times we presume clinically that this could be type 1, this could be Modi, and this could be type 2 also, Pranav.
Thank you. There is one more question coming from my friend Dr. Kaling from India, that is Dr. Shivang Swaminarayan, and he is asking that any good website from Indian Diabetic Society, Gujarat based, as we have high number in Gujarat. Would you recommend any website for general management of modification of lifestyle, diet, doctor visits? Of course, he himself is a doctor, and especially for food care. Any website would you like to recommend to the people in
We
Gujarat?
have we have RSSDI website, and we have guidelines also from the Research Society of Study of Diabetes in India, and doctor can visit the guidelines this website and have the information regarding the uh, uh, further guidelines for those complications related to diabetes. You have diet, you have other complications which can be seen on this website.
Hmm.
We have then
Wonderful.
IJCP guidelines also, I mean API guidelines also, but I think RSSDI guidelines would be better for management of diabetes.
Yeah, we are receiving a lot of feedback from Harshad Brahmbat, Jawaharlal Virji Brahmbat, Amrish, Mr. Amrish Jyoti Patel, and Manisha, Mrunali Parekh, and Sonali Jaideep Javeri. Thank you so very much to everyone. Pushpa Pandoria, we would not be able to acknowledge each one of you, but Jwalant Vrijlal Brahmpat is asking, what are the special precautions to be taken by the patient in in this COVID-19 pandemic? Very relevant question.
Very relevant. I appreciate the question. Uh, COVID pandemic and diabetes. Now, if you look at the comorbidities of the patients, then hypertension, diabetes, chronic lung disease, heart failure, kidney disease, malignancy, patients on immunosuppression therapy. These are the various group of patients who are vulnerable to have more complications than routine patients or the patients without these comorbidities. And coupled with the age, this complication becomes more severe. So if you are having a good control of diabetes, you do better in COVID. If you have uncontrolled diabetes and you by chance you contract COVID, then you don't do better with the COVID infection. So I think it is imperative to have a good control. If you contract the disease, then good monitoring and changes according to the Suppose the patient has got COVID and is on steroid, sugars goes up, then you have to make according to the blood sugar values the changes in the treatment, and most probably they would need insulin. Those patients of diabetes and who are on metformin and who are on SGLT2 therapy, they may have to be stopped during this infection, COVID infection. So all those things would be kept in mind. So I would say that good control is imperative. Monitoring is very essential. If need arises, patient may need insulin, which could be subcutaneous or IV insulin, and then you need to omit certain drugs which can have some problems in the management of COVID. So I think by keeping this thing in mind, we can have a better outcome of patients having diabetes in COVID. Pranav, over to you.
Thank you so much. It seems that we have taken a lot of questions from the open source as well, um, which I was not sure of at the time of initiating the proceedings. But a lot of emotions are pouring on, and rightly so. More than 25 shares just on our Facebook. There are several people joining us from D-Link Live. That is a surprising element today of today's transmission. D-Link Live broadcast transmission in United States. So we are not able to take the questions because of certain regulatory aspects, but we deeply acknowledge your joining us as innovation and healthcare are virtue. They do not need the restrictions of boundary. From wherever we get, other than the medication, wherever we get the health tips, we should always be eager to take the precautions in order to stay healthy and healthy. And we are thankful to each one of you for joining us. We are in the last leg of presentation today. So, Dr. Shah, what is the general overall view of your clinical observation of last 20, 30 years? You have been practicing for a long time. When I read your impressive CV, I know even you matriculated and joined the medicine branch at a time when I was 2 or 3 years old. So you have a long and illustrative career and great popularity of the patients. Yeah, I saw your CV and you joined the medical school at the time of my birth. So I'm very proud of your experience and enrichment in terms of knowledge, ability to deal with critical care. So, what are your general observations in terms of diabetic care over the period of time? What was there before 2 to 3 decades ago, and what is there now in present scenario?
Yeah, Pranav, thank you very much. When I started learning medicine and when I knew the term diabetes, we had only two medicines available at that time. That was DBITD, fenformin, and probably glibenclamide and diabetes. These are the very basic medicine. And we used to do urine sugar examination to look at the control. We used to do urine acetone examination for the control of diabetic ketoacidosis. From there, the journey has started, and now we are at a point where we are doing very excellent in the management of diabetes. And our longevity has improved, our quality of life has improved, and I would say that there is an overall improvement in the management of diabetes for pregnancy, for type 2 diabetes, for type 1 diabetes, and now we have 25 molecules of orally available drugs. We have very purified and analogs insulins are available. We have some beautiful injectable analogs which are not only helpful in controlling diabetes, but it reduces the weight and it modifies the CV risk in the patients of diabetes. We have some beautiful drugs like SGLT2 inhibitors, which are the drugs which controls the diabetes or reduces the weight, and they are greatly beneficial in heart and kidney problems. So, Pranav, there is a sea change in the management of diabetes. What we used to know and what we used to see, and now we have the patients, there is a huge difference. I remember that type 1 children dying very frequently. very at a very young age, because we have not been doing well with the kind of insulins and the monitoring available at that time. Now hardly we see ketoacidosis in children, and they are also doing very good. Their growth is very good. Their lifespan has also improved. So I would say that I am very happy to see the change in the management of diabetes, and we have done something exceptional from you. As you said, we were using the syringes, glass syringes in the beginning. Now we have pens and the other devices. We were doing blood sugar and urine sugar. Now we have CGMS systems which are very good for monitoring. So we are doing wonderfully well as far as the management of diabetes is concerned.
Yeah, but at the same time, the scientific rationale and scientific exploration in order to prescribe the medical medication is very much needed, dear friends. At the beginning of this proceeding today, we did post disclaimer. We are not trying to build up the patient-doctor relationship. This is a general talk show where Dr. Navneet Shah has joined us from Ahmedabad, and he is educating what are the patterns, what modifications can you do. If you have a specific medical conditions, feel free to get his appointment over Facebook Messenger at India, and he will be more than happy to attend your case, as every medical condition is tailor made, and we do not recommend self medication in any given case. And whatever the medication doctor feels appropriate, that should be taken under the strict medical supervision. So, Dr. Shah, there are a lot of myths hovering around diabetes, that once you are diabetic, your life taste goes away. You can't eat what you wanted to. You can't eat spicy food. You can't eat. So there are a lot of myths. People cannot attend the stardom. But when I was reading a book of scientific innovations around at the time of hosting this interview, there are a lot of stardom, including Jay Cutler. They were diagnosed as a diabetic, type 2 diabetes at a very early age. And he was doing his choreographed, and he was diagnosed with type 2 diabetes. So you would have come across many such instances where the stars, when the stars and the scholars, encountered this situation, and you would have helped them to overcome. So, without divulging that identity, would you be able to share some of the experiences of your clinical practice with us today?
Uh, Pranav, we have seen that uh, anybody can have diabetes, and by having good discipline, they can live a normal life. We have seen Formula One drivers having diabetes. We have seen models having type 1 diabetes. We have actresses having type 1 diabetes. We have seen some good cricketers having diabetes. So any anybody can have diabetes, but it is the attitude which is very important. Attitude to keep the diabetes under control, attitude to monitor the diabetes, and just by doing that, I think the extra discipline which makes the person very competent enough to have a very normal life. So I mean, any scholar, anybody can have that kind of thing, and I think one should not be uh, inhibited by the diagnosis of diabetes, and they can always overcome the problem and keep their life good and can achieve any height they want to achieve.
Yeah, when publicly acknowledged celebrity comes to my mind is the best pace bowler of our time, Wasim Akram. He himself was diabetic when he was in the last leg of his cricketing career, and he played
Yeah.
the international cricket. So very right, dear friends. If you have diabetes, what all it needs is proper guidance and monitoring in a scientific manner under the efficient. Under the well trained doctor. Do not go for self medication. Take the medical advice in terms of dietary regime, but proper management can only be done through counseling with the expert in the subject, and you can have your normal life. So, Dr. Shah, what are your overall observation of last 3 to 4 decades of your clinical practice? If you have to sum up your clinical practice in next 5 minutes, the amount of diabetic patients you used to have when you began your career, and now, because of the sedentary lifestyle, lack of exercise, and a lot of TV watching, the world is undergoing profound change. Lifestyles are changing. So, do you see that kind of impact where people play more video games sitting at home instead of going for outing? In our days when we were growing at India, we did not have as much TV as much kids are having at this point in time. So, do you see that kind of a change of life pattern is influencing disease pattern as well?
Absolutely, Pranav. The changes which have come up with the evolution and urbanization has made a significant contribution to the increase in incidences of diabetes. Like TV watching beyond certain hours is detrimental to health, can contribute for the development of diabetes. Your sleep pattern, if you are sleeping less than 7 hours, which many people in these days are doing, if you are sleeping more than 9 hours, you can have diabetes. Now we are a very sedentary, because we don't have time to walk. We don't have to go, we have to go to the school in the bus or rickshaws. We can't walk to the school. We have the schools which do not have enough of playgrounds by which people can have an outdoor activity. So, and then the stress, all stress hormones are diabetes producing hormone. And then we have the stress of all those things, and then we are considered with the extra portions of the food and the junk food. You look at the junk
Exactly,
food,
that's very
which are
important.
very high calorie content of the calories in pizzas and burgers and the large glasses of the cold drinks and aerated drinks. So diet increased, sedentary habits, the sleep pattern, and so many things have taken place. And with all those things, we and then if you look at the genetic theory, our genes were for famine, and when you have an abundance of everything, these our genes do not really tolerate the abundance, and that produces in a way that comes to the surface in form of diabetes, in form of lipid disabnormality, heart problem, fatty livers, and other problems. So these are the problems of evolution and problems of abundance, problems of uh, what we can say, that when you grow rich, these are the problems of all those things comes up.
Yeah, these are the byproducts of day-to-day routine where we do not pay proper attention to exercise, yoga. In one of the presentations I did hear about you emphasizing on yoga as well, and that point has been untouched upon at this point in time. So, would you like to elaborate a bit on what are the natural remedies in yoga as well, please?
Yes, Pranav, I was thinking about that only. When we talk about exercise, I would divide the exercise into three portions. One is that we talk about the aerobics exercise, which help you when you do the exercise, burn the calories, which could be running, jogging, swimming, playing tennis, treadmill, all those things. Then there are some exercise which are muscle building exercise, like you do weightlifting, stretching, Surya Namaskar, all those things, and that improves your muscle mass, which you Indians are known as sarcopenic. Mass improves, and when you improve the muscle mass, you improve the resting calorie expenditure, because your fat goes down and it helps in weight reduction. But the third important exercise is a spiritual exercise, and that could be yoga, meditation, whatever you say, whatever form of you do, whether you do one branch or the other branch. These, particularly this kind of exercise, improves your parasympathetic tone, your vagus tone, and it cuts down the sympathetic tone. Now, the sympathetic activity is related to the hormones which are anti-insulin, like cortisol, catecholamines, adrenaline, noradrenaline. These are the bad hormones at a time where it can increase the sugar and it nullifies or it subdues the action of insulin. But if you do a good kind of meditation yoga, you improve your parasympathetic, your vagus activity, and by that you improve upon the good hormones, you improve upon the catecholamines activity, you can reduce, and in turn those patients who have excessive anxiety, excessive sympathetic activity can be helped by doing all these exercise. So I would say that when we talk about exercise, one has to have the combination of all three kinds of exercise for betterment of life and partly to the management of diabetes.
Wonderful, very well articulated. It's really a treat to listen from a practicing doctor without having any bias or reservation for the naturopathy as well. And dear doctors of alternative medicine science should understand and appreciate well that when it comes from the horse's mouth means very established clinician is recommending and advising to follow the natural regime. Quite remarkable, doctor, and that's where the world is proceeding towards. And with this, I thank you so very much to everyone, dear viewers. This is Pranav here. We are 4K equipped radio transmission facility operating out of Canada. We are just not a Facebook Live. By default, we broadcast on Facebook. We give our terminals to different channels. At India, a lot of people are trying to develop a concept of transmission by using Insta Live or Facebook Live. Uh, we are not in a competition with anyone all across the globe. We wish to bring in quality speakers, those who can educate, those who can make value addition in healthcare sector without
Thank you.
without the without any discrimination of caste, creed, race, country of origin. We try to develop a brand where people do not need to physically travel in order to meet the masses. They can join from the boardroom, from the drawing room to address the global masses. And there is a procedure in place. You need to go to the website of www.npaf.ca, provide your information. We do a lot of market research before we invite the faculty. And in order to put a show in place, we need to do a lot of homework, as our ad time is probably 30 to 40 times more expensive. So as the quality also, as you can see. So, and we have very strong backing of financial support from our sponsors as well. At this point in time, we would like to acknowledge Modial Pharmaceuticals, Cognitrax Consulting Firm. They supported the programs back home at India, and we have our own resources here at Canada in order to float such a program. So we thank each one of them, and we look forward to invite eminent faculties such as Dr. Navneet Shah from
Thank you.
India. And Dr. Navneet, words are poor barriers to express word of thanks and gratitude for sharing your time today in post-COVID era. What else can I acknowledge when you shared your valuable experiences? We don't have words to appreciate your knowledge. You will get true blessings of all the listeners. All the emotions are pouring over social media. I urge, after the proceedings are over, in a day or two when your schedule permits, please respond to them at a personal level through the
Sure.
messenger and take it from there. Any message to the audience? We did not take much of the feedback from. Yeah, I will have to acknowledge Region Biocorp, Pawan Mudgil from NPF Group. Any message would you like to pass on here in the West, as we did not take most of the questions? What would you like to share as a general perspective of managing diabetes globally.
Everybody is doing good now. Pranav, everything is guideline based. So what we do is a textbook recommendation and then guideline recommendation. So probably it is all depends upon the attitude of the people and resources, which will decide the further treatment. Otherwise, everybody knows what to do, when to do, why to do. So I think nowadays, with the advancement and global communication facility, probably we may not be able to do because of our social constraint, but everybody is doing good and everybody is doing scientific and everybody advice is same. So whether I am in Ahmedabad or I am in Toronto or whether I am in New York, my advice would be almost same to everyone. Almost same.
Exactly. Very well said.
Yeah.
Very well articulated. Again, I thank you so very much to Dr. Shah and all the members, those who joined for this broadcast. We thank you, everyone, NPF team, for helping us out to put the program in the right format. And we look forward to welcome another faculty at a different time through NPF from India or other part of the world. Stay tuned. We will announce our program in a near future. Thank you so very much. Thanks to Mudial Pharma, Region Biocorp, NPF, and the uh, funding agencies of NPF. And last but not the least, thank you so very much to Shah family from Ahmedabad, India. Without involvement of home, this program would not have been possible. Thank you.
Thank you, Pranav. Let me tell you that without your invitation and without your help, I would not have been on this platform. So I am equally grateful to you and all your sponsors for giving me this opportunity to talk and interact with the broader audience everywhere in the world. Thank you very much. Thank you, Pranav.